I think I'll start by welcoming everyone. Thank you for joining our fourth session of the Introduction to the National Enhanced CLAS Standards, Understanding Disparity and Building Health Equity around culturally and linguistic appropriate services. As I mentioned, this is session number 4. My name is Eric Senior. I'm the training and content specialist for the Hispanic and Latino Behavioral Health Center of Excellence. And we are very, very happy and very glad to be part of this initiative in the series of trainings together with Dr. Janet Hernandez and in collaboration with the Central East Addiction Technology Transfer Center, who've been very welcoming and amazing hosts throughout the series. So with that being said, if we can move to the next slide. And actually the one before, I don't know if the one before that. Yes, thank you. So in this CLAS Standards training session, one of the aspects of both our center and that we want to promote as part of health equity is offering simultaneous translation to Spanish. Así que hay traducción simultánea a español para este evento. So if you wish to hear today's presentation in Spanish, if you go to the interpretation tab, you click Spanish. Para escuchar esta presentación en español, por favor presionar la pestaña de interpretación y luego presionar español. Estamos junto a nuestro equipo de intérpretes y agradecemos también su asistencia durante el día de hoy. So thank you to our interpreters who are here. And with that, we can move on to the next slide, and I'll leave you now with Dr. Janet Hernandez. And thank you again, Dr. Janet Hernandez, for your presence and your time here for this training series.
Well, thank you, Dr. Senior, for once again the invite to collaborate on this very important issue, and to all of the folks at the National Hispanic and Latino Center of Excellence. And I also want to thank the folks from the Central East for the collaboration on these series. This is the fourth and final one. For those of you who, it's been a while, but for those of you who might be new, let me just say a little bit about myself so that you know who I am, and then we'll go straight into the content piece. So Janet Hernandez, I am from Puerto Rico. I live in Massachusetts. I worked in the field of health and human services for the last 36 and a half years. I worked all over the country doing training and technical assistance on various issues. My areas of focus include health and human services with a specific concentration on substance use disorders, mental health, across the continuum. So prevention, intervention, the multiple pathways of recovery, which include treatment and recovery supports. Also, I am a person in long-term recovery, and that means for me that I haven't used a drug, including alcohol, for the last 37 and a half years. That enables me to be a productive member of my familia, first and foremost, my community, and to be here present with you today. This month is Recovery Month, and we just crossed over also into Hispanic Heritage Month. So I hope that you're having a really good Recovery Month and that you're participating in the Recovery Month celebrations that are happening across the country and in your region, in your respective communities. And also the Hispanic Heritage Month activities that are happening as well. So the focus here, so that's a little bit about me. You'll have my contact information if you want to reach out, or you can reach out to me through the National Center of Excellence, and I'll be more than happy to connect with you, answer any questions, point you in the right direction, provide you with additional resources. So this is the fourth and final session on this series. And once again, it's about the culturally and linguistically appropriate services, or the CLAS standards in healthcare. The class standards are intended to advance health equity, improve quality of care, and help eliminate healthcare disparities by providing a blueprint for individuals and health and healthcare organizations to implement culturally and linguistically appropriate services. This is the principal standard, if you will, if you can recall from previous sessions. We thought it's important to reground the conversation here. And again, the purpose is to eliminate, not reduce disparities, but eliminate disparities. And we do that by leading with equity. And the class standards provide us with a blueprint in how to do that, as we've mentioned in previous sessions. I must say that today's session is not that long because it's the session, and we've covered a number of things here that we'll review in a moment, which include the fact that we've defined disparities. And not only defined disparities, we've also had a conversation about their impacts on marginalized and racialized communities here in the US and throughout the so-called territories. We've also defined and in greater detail about what health equity is, what it looks like, what we should do to lead with health equity, as well as how do we include people from the community in this process, and the relationship between eliminating disparities, leading with equity, and the work that we all do on the ground. We've also identified how cultural, behavioral, and health systems and those factors converge and contribute to unequal access and differential care. I would have us reflect on the fact that we've reviewed cultural elements, right? And we've talked about what those things are and what they look like. We've also talked about behavioral factors, right, at the individual level. And you recall, we have emphasized the fact that the field of substance use disorders and mental health have historically put the onus on individuals and said, if you want to get better, this is what you need to do. And we've done that in rather punitive ways with a criminal injustice approach to a series of public health challenges. And so we put the onus on individuals. Throughout this series, we've talked about systems and the need to understand a systems approach and the responsibilities of systems to change to meet the challenging needs of the communities that we serve, right? So yes, we focus on cultural issues. Yes, we focus on behaviors and behavioral health and responsibilities and accountability at the individual level. And we should move more towards holding systems accountable. And we know that systems are composed of policies, procedures, ways of doing things that either enable some people to get in or make it more difficult for some people to get in and push them out of care. And so the emphasis on systems is extremely important if we are to build sustainability for eliminating disparities and building health equity. And then we've done a lot of work to describe benefits of implementing the class standards. In other words, why we should implement the class standards, and by focusing on the disparities. Hopefully, those have come across. And of course, we're talking about implementing the class standards across behavioral health settings with growing minoritized populations. Again, the demographics in the US have been changing since the inception of the country, since the founding of the country. Right now, historically, we are at another critical juncture with the demographics, according to the last census in 2020, tells us what communities are growing, expanding, what are the different aspects of those communities in terms of the cultural elements, including language and other factors, and how we should be prepared to meet those needs, right? And thinking about that from many different levels. So from the perspective of the organization composition, right? So who's on your board of directors, who's in senior management, who's in middle management, who's in frontline service delivery, and who should be there according to the changing demographics and what we need. We know that there has been a lot of documentation about the behavioral health workforce crisis. And in a nutshell, it's been described as the people in the field are primarily white, female, baby boomers, and retiring, those four elements. And the client population walking through the door or in communities in need of services are younger and more diverse in many different ways, not just in race, ethnicity, and language, but also as it relates to age, gender, gender identity, sexual orientation, ability, cognitive and physical, socioeconomic status, and other factors that are important for us to understand by way of the diversity of what's needed within our workforce to best meet the needs of the populations in need. So we've been able to describe all of that. And bear with me as I come to an additional slide that speaks a little bit more about the previous sessions so that we can ground today in that conversation as well. So we have been able to identify business strategies to build organizational capacity to deliver culturally responsive services to diverse communities. Again, thinking about that diversity, which is extremely important. Identify opportunities for class standards integration into your role, and not just at the individual level, but our role as service providers, as supervisors, as managers, as directors, as senior staff, and then to think about how we incorporate, institutionalize those practices by way of policies and procedures so that we build, again, coming back to that theme of sustainability throughout. And then list technical assistance opportunities to support organizational implementation of the class standards. There are a number of resources that have been made available by the federal government and others to provide technical assistance and training similar to what you've been receiving over the last these 4 sessions, and how to access those moving forward. So in terms of the review of the previous session, is that this session hopefully pushes us to think about an action plan. How do we then take all of that information, all of that knowledge, everything that we have learned throughout this experience, and turn it into an action plan that will enable you to implement and sustain the class standards over time, right? And contribute to the elimination of disparities and building solid and sustainable equity across the board for your participants, for the people who come to services, and even expanding to those who might not be in care because they experience different barriers, which include organizational barriers that have to be dealt with if we are to truly serve everybody at the community level. So today is dedicated to that. I'll share with you some resources, some examples of checklists, those sorts of things that help us move in that direction. Feel free to raise your virtual hand, to put a question in the chat, anything like that. Again, today, the session is not that long, but I want you to be thinking about the stuff that we provided in the previous 3 sessions and some things that you might have questions, comments about, or maybe even some things that you have already tried and have had some level of success or challenges with that you might want to share with the larger group here. So in terms of working towards the effective implementation of the enhanced class standards, right, at your organization, this all begins with implementing or convening a working group to include representation from all levels of the organization, right? So members of your board of directors, remember what we've said before, there has to be buy-in from the board of directors. There has to be a liaison, or not just one person, maybe more than one people who are involved in working towards the implementation of the class standards. And so you would need to work with your executive director, with your senior management team, so that they can work with the board to identify who on the board is going to be on this. Then, of course, you need senior, executive, supervisory, and frontline staff. And so here I'm going to pause to say a few things. There needs to be consistent participation and buy-in from senior and executive level folk, right? And I've seen in many organizations where this is present in the working group, and it goes really well because there's buy-in, there's a presence from the board and senior. But I've also seen it where the focus is on maybe one or two people in supervisory roles and frontline staff, and a lot of participation from frontline staff. And when that happens, there's an imbalance of power. And so we know that in order for the national enhanced class standards to be incorporated into the organizational culture, into the organizational policies and procedures and ways of doing things, there has to be a review of policy. There has to be a review of the importance that's given to this stuff. And many times frontline staff don't have power over changing or making policy for the organization. It's important that they be present, but it's also important that there be balance in the representation. And when we talk about frontline staff, think about what that means by way of an added responsibility. So for the supervisors, for the directors in the room, you want to think about how either you compensate people for their additional time working on these things, or you flex some of their time, or you provide additional benefits for these folk who are on this working team. And so you want to make sure that you validate their participation, that you recognize it, right? That you celebrate their participation. And that can be done in many different ways. Again, frontline staff usually complain that, okay, I'm giving, this is yet another committee, another set of responsibilities. And on top of that, I need to see all the clients that I need to, or working in the community with all of the folks that I'm working with. And so give that some thought by way of thinking about representation from all levels of the organization. And then this, we're presenting this in this sequence, but this is not in order of priority. It is extremely important that there be representation of people receiving services. And so what organizations have done traditionally is that they have thought about people who have had really good experiences within the organization by way of receiving services. And that's an important subgroup of people to include. But you might also want to include people who haven't had a very good experience within the organization. They have some data and some input that they can share with you, with us, that is going to help us better to understand what are the barriers of people who haven't had that much of a positive experience within the organization. And the third subpopulation that I would think of is people who haven't received services at all. And so that requires partnerships at the community level. That requires that you have buy-in from the community and that there's some level of trust, because people who have never received services also have a lot to say. They've been in the community. Why haven't they heard of the organization? Why haven't they heard of the services? Or maybe they have, but they decided not to approach, and why did they decide not to approach the organization for services, right? Again, community level representation your organizations works with. And so another important note here is you might want to include, this works really well when you include other partnerships that you have. I'm hoping that most, if not all of you, have partnerships with other organizations that are formal partnerships. In other words, that there's formal memorandums of agreement, memorandums of understanding, including those folks or representation in this work group becomes extremely important. Again, think about the diversity of the work group as it relates to race, ethnicity, gender, gender identity, sexual orientation, socioeconomic status, age, ability, etc., all of those things. Other considerations to think about is what day in the week and what time of the day do you convene this work group? Remember, if you want community participation, there needs to be flexibility in that, and not just think about the hours of operation of the organization, but what hours are more conducive to have community representation within the work group, right? I've seen organizations say, okay, so we're going to do this at 9 o'clock in the morning on Mondays. And the people receiving services or from the community who might want to participate cannot participate because it's at that time and they have other responsibilities with familia, with other work that they're involved in, or just other responsibilities in general. Some organizations, in terms of convening a work group, they have selected predetermined dates, and some organizations have been more effective because you want to be flexible. Some of the meetings we're going to do in the evening, some of them we're going to do in the day, and some organizations have even had some of the meetings over the weekend. And so you want to think about that so that we don't create the flexibility, I'm saying, so that we don't create a structure that's even more hard for people to participate, because then what happens is we end up speaking to the same group over and over and over again, right? And when I said people who have had good experience, and I'm talking about the service recipients, people who have had good experience facilitating those meetings with people with good experience is somewhat less challenging than facilitating meetings with people present who have had more challenges with the organization. That means that there needs to be thought given to who facilitates those sessions, what's the skill set, what is the expectation, and that it's extremely important that people don't get defensive when they hear some feedback from community members about what their experience is. I know that I've said a lot within this slide here in terms of convening a work group and who to think about in terms of participation, some of the issues that will come up, not might come up, but will come up. So I want to stop here and ask, are there any questions, any comments, anything that you want to raise as it relates to this piece? And you can raise your virtual hand or you can put something in the chat. I want to give a moment to this because this is a critical, important piece here. It also gives me the opportunity to take a sip of water. If any of you have already convened a working group and you want to share a little bit about that experience or some of the things that I said, or some of the things that I didn't say that you think is important for all of us to take into account, here's an opportunity to do that as well. Okay, so having heard no one chime in, if you still want to do that, you can put it into the chat, or once again, you can raise your virtual hand and we'll take it from there. The next piece is conducting an organizational assessment. Many times what happens with individuals is that we want to go to the action, right? We know what the problems are. We've already heard them. We've been here for a while, and what we want to move to action. Um, that is somewhat problematic for many different reasons. Many times we don't know everything there is to know about what the challenges are. So an organizational self-assessment becomes extremely important, right? And so how do we conduct an initial organizational assessment? And part of what we can do here is to do key stakeholder interviews, right? To determine the stage of readiness to implement the class standards. Let us not assume that just because one or two people from within the organization decided that it's important for us to implement the class standards, that everybody has bought in to that process, right? So to determine where the organization is at becomes extremely important. And a core group of people from within that work group can lead this effort, right? And come back to the larger group and report back. So for example, I worked with an organization where the executive director and senior leadership, a few people said, this is important. We're going to implement the class standards and we're going to full-fledged ahead. When we slowed them down and said, let's do an assessment, let's figure out where folks are at, and let's use stages of change as the tool to determine where people are at, as the organization in pre-contemplation, in contemplation, in preparation, in action, or maintenance for the implementation of the class standards. Initially, that core group of people said, no, we are in the preparation phase, clearly. We're in the preparation phase. We've contacted you, we've had some meetings, and it turned out that those meetings were only with senior people. There was no one from the board available and no one from frontline staff. And so when we looked at it, it's more along the lines of contemplation in terms of stages of readiness, which when you are in the contemplation stage, different from the preparation stage, there's things that need to happen to get people to that preparation stage. When I say people, the entire organization in that direction. That included, you need to bring people from the board up to speed, and there needs to be buy-in from the board. You need to bring in people from, they had senior management and the executive director, but you needed middle management people to be on board, frontline staff, and you needed communication with partners and community level folk that this is something that you were embarking on. So they had to slow it down in order to bring people into, and some people were at the individual level, they were in contemplation, like, this is not a problem. I don't know what we're doing here, right? Once you lay the groundwork, then you can move people towards contemplation and then moves towards preparation. Some people wanted to move directly into action in terms of the stages of change, and that was inappropriate. It's not going to happen that way unless we have full buy-in. Now, you can move it forward without full buy-in and without full consensus, but that will mean that will impact sustainability, that will impact outcomes, that will impact the probability of the class standards being implemented in an efficient manner. We should use the implementation checklist to help guide the process, and we're going to come back and show you an example a little bit later on of the implementation checklist to help guide that process. We need to take the required steps to move for readiness for actions. This is in part what I was talking about earlier, right? There's some steps, and sometimes, again, there's a hurried, like, we need to do this and do this right away because we need to respond to the needs of the community. And that is a really good reason. We need to respond to the needs of the community. But if we don't slow down and deal with the issue of readiness, then again, the outcome is going to be impacted. Another piece here is we need to select the appropriate assessment tools. For people at the individual level, we've covered with you what some of those tools are, right? We know that the individual assessment tools take about 45 minutes to do. The National Center on Cultural Competency has a number of tools that you can select from at the individual level. They take about 45 minutes to do. Then you need to score them at the individual level. And remember what we've recommended in the past. once you do an individual self-assessment to see where you are at the individual level, we recommend that you share that with other people that you trust. And so if the organization creates an environment of trust, that people in the working group, they can complete their individual self-assessments. A meeting of that working group can be to share aspects of that individualized self-assessment. And people can share where they are, where they want to be, what they've learned from the self-assessment, that sort of thing. The organizational self-assessment takes longer, right? And those tools are also available to us in different forms, including from the National Center on Cultural Competency. But you get to select what those tools are and what you want them to be. That organizational self-assessment is going to take way longer than 45 minutes. It's going to take a series of meetings to get everyone involved, because you need, again, representation and participation from the board, senior management, middle management, frontline staff, community level people, partners. We need buy-in and participation from all of those. So selecting that tool becomes extremely important. Then some of the questions: what resources do you need to be successful? In order to do this, right, we're talking about human resources, we're talking about people's time, and in many cases, it's about monetary. So the organization needs to identify a budget for this, working in collaboration with that working group. How much time is this going to take? What's the timeline? How much people effort is going to be required? And any additional resources. And some people have asked me in the past, so what do you mean by additional resources on it? And I give this example. If you are going to engage people who have received services or who haven't received services from the organization, let us not forget that many times we ask them to do things without compensating them. And so what we recommend is to think about how you compensate them for their times. And some organizations have provided gift cards. They have provided a meal during meetings when people come, and all of that costs money, right? So think about that, so that we're not, paying all the staff who are attending, right, but not compensating and validating people's time at the community level. And then there needs to be a work plan with a timeline, and there needs to be a delineation of responsibilities. In other words, with just talk, it's not going to happen. There needs to be a very specific work plan. Hopefully, your work plan for this is in line with whatever strategic planning document your organization has. In some organizations, this has worked well and timely because they are working on the strategic plan for the organization. And in some places, it hasn't coincided with the strategic plan, but elements of the strategic plan can be upgraded, can be updated to reflect the institutionalization of the class standards and all of those responsibilities, right? Again, we want to be intentional. When there's intentionality, then the probability of implementing the class standards with sustainability is that much higher. And a work plan helps us to do that and be very purposeful. Again, representation up and down the board. I would also caution against fatigue, right? And fatigue kicks in when we are not paying attention to issues of burnout from within the participants, but also when we're just in meetings talking and things are repeated. That's why, not when, but that's why having a work plan with due dates, with timelines, with responsibilities of who's responsible for who is extremely important. And from that work group, there's usually an executive team that comes out of that with representation from throughout the organization that is going to hold everyone accountable to the work, because this is work and it's a lot of work. When done well, this work will make the work of the organization easier in the long run. Questions and comments about conducting an organizational assessment, things to consider there, anything like that. You can raise your hand or you can put it in the chat. Okay, so I'm going to move us forward to the next slide. Again, if you come up with any questions or any comments, please let us know. So Alba in the chat said, thank you for sharing. It is very informative and things that I would not think about. Miera says, does this include community buy-in or just internal to the organization? Very good question, Miera. I think it's both and. It's internal, but also community buy-in. I don't see how any organization is successful at anything without having community buy-in. And because we are talking about assessments and involving the community in those assessments, then there has to be time, attention, resources provided for that portion of it, right? Not again, but this is something I didn't say. Many times we're using language in assessments, in meetings that are not accessible to the people that we work with. Right now, this is being translated Spanish. Think about the language needs of the people that you bring into a working group. In terms of different languages, the spoken word, right? Spanish, French, Creole, whatever, English, those languages are. But I also think about sign language, think about, right, the written language that we use and the verbiage that we use. We use a lot of acronyms and we speak in ways in health and human services that we're speaking to each other. And many people vote with their feet because when we invite them and we're talking in verbiage that they don't understand, most people, because of issues of intimidation, education background, or what have you, they won't raise their hand and say, I don't understand what that means. And I tell you this from personal experience. When I started off in this field, I was very afraid to ask questions, right? I was very afraid to ask questions. Angela in the chat says they need to understand the words you're saying to them or the conversation that we are engaging them in. I would add that. Thank you for that, Angela. I would say again, create spaces and places where people are comfortable in terms of their participation and that they're not being spoken at, but engaged with. Thank you for all those wonderful comments in the chat. If there's anyone who wants to chime in out loud, please raise your virtual hand and we'll unmute you and bring you in.
Dr. Hanier, before you move on, we did get a question in the Q&A.
Okay.
I won't say their name. I don't know if they want to remain anonymous, but is there a class training certification? These series have been amazing, but how much more training do we need to be competent in helping the implementation of class in our organizations? Okay,
let me come to that Q&A question in a moment. I just want to pick up a couple of things that are in the chat. If there's buy-in, if there's buy-in, but some pushback on the assessment piece, how do you handle that? It's a really good question. So there is buy-in to certain aspects of it, but not the assessment piece, right? Is what I'm hearing from that question. It means that we haven't done a really good job of explaining how we will not be effective unless we do assessments, because the assessments will help us formalize people's feedback and gather feedback from all levels of the organization and community and partners. And so my experience has been when we explain to people, when we enter into conversation as the why, the rationale for doing this, then there's more buy-in and people will say yes. And also, it's important to let people know regarding any assessment piece is that you can provide your input anonymously, you see, because some people are afraid to say some things out loud. And so if we ease that fear by way of having mechanisms in which people can do a survey, they can, provide something in writing, handwritten, and put into a box which is anonymous. Those sorts of practices also help increase the probability that people are going to be more open with the information. So it's a combination of things. It's explaining things in ways that people can understand. It's providing multiple opportunities for providing assessment input in writing, anonymously, via email, via an anonymous box within the organization, or they can speak to people that they trust will hold their information in confidence and provide that verbally, and then that person can provide that assessment information in a way that's confidential and doesn't violate their confidentiality or trust. Angela says they just need to be seen. They just need to be seen. I'm assuming that you're talking about folks who might not have been traditionally seen or recognized by the organization. I think that when we validate people, we validate their interests, and we do the list of things that we've been talking about here. Again, the probability exists that people will engage in this process. Rhonda, I'm glad that that was helpful to you. I'm going to shift to that question in the Q&A. Is there certification? The answer to that is not to my knowledge. There's training that we're doing across the country, funded and supported by the federal government, but is there certification around CLAS? No. These series have been amazing, but how much more training do we need to be competent in helping the implementation in our organizations? That question is that question is relative to who you have on your team, and that initial team, right? Before you come up with the work group. So who is on that team? Who from your organization has participated in this training, and who hasn't? And who do you need to develop more competency in terms of understanding the class standards? So again, back to assessment. You need to look inward to your organization and figure out what the stage of readiness is of the organization, who's on the team, who is in a place where they're not contemplating it, they're not in pre-contemplation, but they're in a place that they have command of certain aspects of it. Not everybody needs to be at the same stage, right? Not everybody needs to be at the same stage, but there needs to be buy-in. And that organizational assessment becomes extremely important, right? In that sense. And then as you identify, this person needs more, this person is okay, this person is very entry level, then that gives you a better understanding of what next steps to take. And again, I'm going to bring this back to the addiction technology transfer centers that are funded across the country. All of the centers have training materials and webinars that have been pre-recorded, such as this one that's being this series that has been recorded. Then you can point people, you can assign people, okay, do these sessions, and then have conversations with them about their questions or understanding. That way you build the capacity of at the individual level, but also at the organizational level. And then the training and technical assistance centers that have been developed, those are extremely important. And you can always reach out to our National Center, Hispanic and Latino National Center of Excellence for training and TA. That's what we are funded to do here. So I love all of the questions and all of the comments in the chat. It seems like you're giving a lot of thought to, okay, what do we do next? What do we do next, right? And this is not a one and done. We are here to provide additional technical assistance and support in your process. Is there anything else from the chat, or anything else from I don't see anything else in the Q&A.
I did have something that I wanted to piggyback on what you were saying. You mentioned how we have been recording these sessions. One thing that, so the ATTC has been confirmed their funding for the next grant cycle. So one of the things we're thinking of doing is packaging anything we've done with CLAS and putting it on our e-learning website and creating a fact check list. That way people will be able to go at their leisure. It'll be free. They'll be able to go at their leisure and explore and do some fact checking for themselves. So that is something we're working on very soon. So I'll keep you all in the loop. But just stay connected with us. And like Dr. Hanera said, stay connected with the National Hispanic Center.
Perfect. Thank you for that. And congratulations on all the
Thank
ATTCs,
you.
including yours, for being refunded, right? That's awesome.
Yes. It
That's
was
awesome
a very
news.
long wait.
And I think to the deadline, right? Which is September
Yeah.
29th. So yeah. So that's really good news. There's a commitment from the federal government to implement the class standards. And as we've said before, the class standards are not new. I should say the enhanced class standards. These are not new. They've been around for over 2 decades now, right? We are in the third decade of the class standards, and hopefully there will be additional implementation. Yes, and so people are saying congrats in the chat. Thank you for that. Keep any questions or comments coming in the chat or through the Q&A. So we need to consider the environment in which we work, the culture of the organization, the culture of the programming, the culture of what that looks like in that environment. Is it a welcoming culture? Is it a culture that is not that welcoming? And so there are tools to help us to do that, right? With that look inward in the organizational self-assessment, there's also a checklist, right? So what are the organizational values? These are things that working group can work through to figure out, right? What's the governance, right? What's the governance look like? Again, from the board of directors all the way down to people receiving services. What is the accountability of that governance to and from people in the community? What does planning look like, right? What is the planning of services look like? Who's involved, right? Who has input? Who doesn't? Why not? Should they, right? How do we create that culture of participation, of validation, of supporting people in their process of giving input? Evaluation, monitoring. So quality improvement, quality assurance. What does that look like, right? How do we evaluate things in real time? And there's a real feedback loop into programming and participation. Many times, evaluators come into these processes, they collect data, they provide a report, nothing happens. When you have a feedback loop, an immediate feedback loop, and use participatory evaluation or other aspects of evaluation that, again, includes that feedback loop, then people can incorporate all of that feedback back into programming right away and not having to wait. What are the language services and what they look like, right? The class standards, that second theme is all about language and accessibility. And so what does that look like for the organization by way of having multilingual staff, by way of having additional resources for translation live for people who need it, whether that's telephonic, using AI or what have you. Also, the written word. Let's think about people who read Braille, right? People who are deaf and hard of hearing. So think about language in a more global way, in a more expanded way of the definition, as opposed to just the difference between English and French and Spanish and German. Those sorts of things that are really important for us to take into account. But language services, what's the culture of the organization around this stuff, right? And it should not be a culture of parentifying kids, utilizing inappropriate people for translation who have no business translating medical or treatment information, confidential information for people. And then workforce and staff development. What does that look like for the organization by way of culturally, right? What does the workforce and staff development look like? I was just this morning in a meeting around workforce development where people think that workforce development is just about getting a credential, certification, or licensure, and that's workforce development. Well, workforce development is about mentoring. It's about career ladders. It is about supporting people in getting credentials, but it's also, supporting people in getting a degree who might not have, a master's or some other type of degree that they need. And it's not always about credentials and degrees. Staff development is also about what do people need to do a better job, including supervision, support, which goes to the last bullet point here, the organizational infrastructure. What does that look like? I can't tell you how many times I'm in a meeting with clinical people and I ask, how many people here have clinical supervision? And not all hands go up. And so that is about workforce development. That is about providing an organizational infrastructure that supports people who are doing the work on the ground. This reduces the probability of burnout. This reduces the probability of staff turnover. This increases outcomes, positive outcomes for the people receiving services. When we have a solid workforce that is committed, that is well-trained, validated, and supported, then we increase outcomes for the people that we serve and the people that we want to serve to our doorstep at the time. So those are some things to consider here by way of a responsive treatment environment. I'm sure that there's more. And if you want to put anything in the chat that you can think of about a responsive, culturally responsive environment within the organization, I welcome you to do that. Again, for me, is also amplifying and lifting up the voices of people who receive services with very good outcomes, people with maybe not so good outcomes, and people who have never been there. How do we create an environment that we're always thinking about? How do we bring them in to the conversation? How do we bring them into the fold? How do we make our organizations richer by way of culture and otherwise when we bring those individuals in? So here, we want to talk about resources, right? And so in terms of the Hispanic Latino Behavioral Health Center of Excellence, our Center of Excellence, we have a number of things that we offer, right? And so you'll be on our email listserv, so be on the lookout for our newsletter, and you can sign up for the newsletter. You can request TA, and you can request TA from the center in many different ways for many different reasons, right? But we are available as resources that can help you get to where you need to get. And if we need to pull in other partners, such as the ATTCs from your region, similar to this partnership here, we'll bring in those resources. The Center of Excellence has a list of people like myself and many others who are trained and have proficiency in many different areas. And once you put in that TA request, it's going to be reviewed with the eye of what's the best fit for you. Are you looking for TA? Does that TA include training? Is there additional resources that can be brought into that space for you? And that's what we're funded to do. The federal government has moved away from just providing training. Training is good when it's connected to TA, because you know what happens. You hear other stuff about the class standards, then you need to go and implement the class standards. And that's when all the questions come up. And so you need to be able to reach back out and say, okay, I have this question about this, or we're struggling with this portion of it. Can you help us with this? And we can come in and help with that. That's part of the contracting here. Let me take a look at an additional message. Eric just put in the chat, thank you, Dr. Senior, put in the chat the link to our webpage, so please go there, right? We're going to share with you here the implementation checklist for the national class standards. We've been talking about this, right? It's in the link in the PowerPoint. And so we just went to the link. And now we want to be able to scroll up here and show you I cannot scroll up. Can you do that for me? Yeah. So you see here in the table of contents, let's stop here briefly, right? The introduction, the background, the getting started, implementation checklist, and then your organization's class action worksheet. And then to that piece, you see the testimonials by other organizations that help to build the buy-in. So you see that this is comprehensive. It has tools, it has background information. So to the person who asked the question earlier, what if not everyone's on the same page? Well, that's to be expected. This checklist is not just a checklist. It helps with all of this stuff. Scroll up. So you see we're scrolling past the introduction there, the background, what is class, all of the stuff that we've been talking about over the last 4 sessions. Continue to scroll up, getting started. And so, you put in your information, your role, your title, the division, the organization, keep scrolling up, right? And then you see the first theme comes up here, right away. This is governance, leadership, and workforce. And so it's going to ask you a series of questions around that. Remember, this is the first theme, right? So identify and designate a class champion or champions. Again, this is building the buy-in, right? Create and implement a formal class implementation plan, right? It's going to ask these types of questions. And I'm going to read to you one more. Target recruitment efforts to the population served. Increase the recruitment of culturally and linguistically diverse individuals. Again, this is giving you a flavor of what that assessment tool is going to ask, or the checklist is going to ask you. Let's scroll up more. And then the second theme you see here, right? All about communication and language assistance. We've covered this over the last few sessions, right? Here's some samples questions. Complete an organizational assessment specific to the language assistance services. Standardize procedures for staff members and train staff in those procedures. And then a third one is provide individuals with notification that describes what communication and language assistance is available, in what languages the needs assistance is available, and to whom they're available for, right? And so you see the samples here about the checklist. Doing the checklist is going to enable you to say, this is what we have, this is what we don't have, this is what we're planning, right? This is what we're currently implementing. And that gives the work group additional ammunition, if you will, for the work plan itself. Scroll up some more. So we can look at theme number 3. This is the final theme, right? Engagement, continuous improvement, and accountability. Some examples here: incorporate class into the mission, vision, and/or strategic plans. Remember, I talked earlier about strategic planning. Is it in line? Is the strategic plan of the organization in line with the class standards implementation plan, right? Is class reflected in the mission and vision of the organization? If yes, great. If not, what's the plan for doing that? Who should be involved, right? Tailor existing evaluation efforts to include measures of class implementation. Most organizations are collecting data. Many are funded by the federal government and other funding sources that require evaluation. Are those evaluation tools, standards, vision for evaluation in line with class measures? If yes, great. If not, how do we make them to be aligned? If some are and some not, how can we work so that they come in line with evaluation methods? Complete a class-related organizational assessment. I've spent time talking about that, right? So are you there? Have you completed one? Have people completed it at the individual level, at the organizational level? If yes, great. If not, what's the plan to do that? Selecting the tools, all of that. Again, that goes into the work plan for moving the organization forward. So we want to give you a taste of what the implementation checklist looks like, right? It's in the link. You'll be able to go to it. Now you can Google it and go straight to it, download it. Please don't do this by yourself. I know that you are committed individuals. You come to this training, to this series, right? And you're here and you're really committed. I would encourage you to slow down and figure out who else needs to be involved in going through the checklist. The more people that you involve, the greater the buy-in. The lesser people, then you will be making decisions for others and sometimes making assumptions because we don't have all of the information. The only thing that we can do is assume if this is working or not. And it's important to reach out to people when you have a question because you arrived at a certain point in the checklist that you don't know the answer to. It's important that you have a team of people, a team approach in coming to the checklist. We can stop this share here. We can stop the share here and we can entertain any questions about the implementation checklist. Anybody in the chat or in the Q&A? There's something in the chat that I haven't seen. Let me go to that now. Okay, so you see the link. Dr. Senior also included the link for the checklist. So you'll get it in two forms. You can do it from there and click on the link, or you'll get it from the PowerPoint. And again, you're not alone in any of this stuff. When you have questions, you can reach out. When you have anything of value that you say, well, we need to check in on this because we've done our due diligence and we need external help, we're here for that. And we're not, as people who provide training in TA, we're not here to judge anybody or any process or any organization, and we're not here to report anyone to any funding source or anything like that. We are funded to provide technical assistance, training, guidance, support, and feedback to the organizations that are in need. And so that's part of our mantra, part of our lead. It's not to do any of that. I say that out loud because some organizations are struggling with something, and rightfully so, they think about who should we say this to, because we don't want to be seen in a bad light by the funder. Know this: the funder at the federal level and all funders have an understanding that our organizations need help to implement the class standards and to implement programming. So asking for help is not necessarily seen in a bad light. All right. So here are some additional resources that we wanted to share with you. We're really close to the end here. But you see from the ATTC's Building Health Equity and Inclusion, there are free resources through the ATTC network around the health equity and inclusion. There's a roadmap for technical assistance efforts in substance use services administration. So there's a roadmap there. These are links that you can go to, and you see some of the images here around that. Advancing health equity at every point of contact. And so, you know, this link here, Think Cultural Health from the Health and Human Services Administration. You see the link there. And then Building an Organizational Response to Health Disparities, a practical guide to implementing the national class standards. Again, we've said it throughout. There's a practical guide. I mean, people have done a lot of work on this. You don't need to reinvent the wheel. All you need to do is to access these resources. And when you do come up against questions, comments, or barriers that you need to do, even then, I sound like a broken record at this point, you're not alone. You can reach out for some TA and training from us. So health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or socially determined circumstances. Again, we've emphasized here a great deal on systems approach. And when we build our organizations with the capacity and understanding, because we have implemented the class standards and we continue to implement them because they're not a one-shot deal, then this increases the probability that we are eliminating disparities at the individual level, at the family level, and at the community level. And so this is why class matters, right? This is why the enhanced class standards matter, because we're responding to those needs of people at the community level. Are we anywhere near eliminating disparities in the country? Of course we're not. We're not. It would be disingenuous to claim that. But we can do our individual, our organizational, our collective portions to contribute to the elimination of disparities at many different levels. And we can continue to do advocacy to raise awareness. And those of you as organizations who do this and do this well, you will be in a position at the individual level, at the organizational level, to speak to what you did and what your experience was, what your journey is and has been around implementing the class standards in a proficient way. And that way we contribute to the development of capacity to other organizations across the country. So with that, I'm going to stop there for any questions, comments. That is our last slide for this series. But any questions, comments, anything that you want to either put in the chat or put into the Q&A, here's an opportunity to do that. And Eric, Dr. Senior, or anyone else from the team who wants to add anything here, it's an opportunity to add any recommendations or comments as well.
Thank you, Dr. Hernandez. I've been just reviewing the questions and the conversation, and that's been in itself really insightful to know what the workforce and the providers, everyone who's doing this great work is reflecting on, and I think have very critical and important considerations about how to improve class standards. We hope, and I think this is something that our center is hopefully bringing as one of our potential future events, still not posted, but we hope to have that, is around interpretation services, because that's one point that we understand that is of much need, and sometimes for those providers who want those linguistic appropriate services to be within their settings, interpreters are a key of key clinical service and of key service provision. So hopefully, if you check out our website, you'll see some of those events that align to culturally responsive services as well.
Thank you. Anybody else with a question or a comment? I want to say from my end, once again, thank you collaboration. Thank you for your participation over the last 4 sessions. You have contributed to my learning and to my contribution to this field and this important work. Continue to do what you do. And happy rest of Recovery Month, and then happy holidays that come after that. So thank you. In the chat.
Oh, yes, thank you.
In the chat, we just put in, or Dr. Senior just put in the post evaluation, the post event survey. Please complete that because it enables us to report to our funder. And more importantly, it enables us to understand what your needs are and what you got out of this as well.
Yeah, thank you. And congratulations again to the Central East ATTC for that renewed funding for the grant. Yes, thank you everyone who have joined today. It's really been a pleasure to have this type of collaborations between centers, both our center and the Central East ATTC. This comes to an end, and I think with very great and exciting news that we'll be able to continue to implement and provide and disseminate best practices such as this ones, those that are accessible and move us towards equitable services. So yes, please, if you can move, I think next to the last slide, which has a QR code for those who may not be able to use the link on the chat. You can also scan this next one for the evaluations. Next slide.
Mm-hmm.
There's a QR code both in English and Spanish, so you can let us know about what you thought about this. I don't want to prime it, but I thought it was a wonderful presentation and a series as well. So let us know. Let us know your feedback, and thank you so much.
Thank you, everyone. I just want to extend a thanks to the team for this journey that we started back in, what was it, February, I think. We've had a long ride, and I really appreciate all the sessions we've gone through. This is the first time, at least since I've been at the ATTC, that we've had live translation services. So that's been a huge thing for us, and we're hoping to make it somewhat routine for most of our events. So I'm looking forward to the future collaboration that I know we'll have.
And thank you to our interpreters who are behind the
Absolutely.
scenes, Katira and Brenda, who have offered us such an amazing and well-rounded translation of this class standard series.
Dr. Herner, I believe someone asked if it's okay to share your contact info. It should be on the slides, correct? Maybe.
Yes.
Slides.
I believe so, but if not, I'm just going to put it in the chat, and
okay,
you can share it at will with everybody there. It's my phone number and my email. Thank you for completing the survey.
Thank you, everyone. If there aren't any last-minute questions for myself, any of the team, or Dr. Herner, I think it's okay for us to go ahead and close out. We can give everyone the rest of their day. Please feel free to reach out to us if you have any questions. I'll also put my email in the chat. Thank you again, Eric and the team. Doris, I'm sure myself or Andrew will be in contact with you guys. So I'm looking forward to the upcoming year.
Yes, us too.
Yes.
Congratulations on your continuation grant.
Thank you.
Yeah, thank you. Thank you. We are very excited that you have this renewed funding, and we'll definitely be in contact again to continue this great series. Yeah,
absolutely.
Initiative. Thank you.
Thank you.
Okay,
Enjoy the rest of your day.
You too. Take care.
Bye.
Bye.